Ginger is renowned worldwide for its health benefits, from soothing digestive issues to alleviating nausea. For centuries, this root has been cherished for its therapeutic properties. However, there are specific situations where ginger might not be the best choice for your health. In this video, we'll explore the scenarios where you should avoid ginger, helping you make informed decisions about its consumption. Before we dive in, please note that all information provided is unbiased, fact-checked, and reviewed by qualified health professionals. Now, let's get started with the 9 situations where you might want to skip ginger. 1. Bleeding disorders. If you have a bleeding disorder, be cautious with your diet. Ginger has blood-thinning properties that could exacerbate bleeding. Its active compounds, such as gingerol and curcumin, can interfere with the body's natural clotting process, leading to prolonged bleeding. Individuals with bleeding disorders should consult their healthcare providers before adding ginger to their diet for personalized advice. 2. Diabetes. Ginger may lower blood sugar levels, which can be beneficial for some but risky for those managing diabetes. Sudden drops in blood sugar can lead to dizziness, weakness, or even fainting. Additionally, ginger's blood-thinning effects and potential to cause digestive discomfort could complicate blood sugar management. Diabetics should monitor their ginger intake closely and consult their healthcare provider. 3. Gallbladder issues. For those with gallbladder problems, ginger's ability to stimulate bile production could worsen symptoms. Its blood-thinning properties might also pose risks, leading to bleeding or other serious issues. It's wise to consult with a healthcare professional before incorporating ginger into your diet if you have gallbladder concerns. Alternatives like chamomile or peppermint tea may be gentler on your digestive system. 4. Heart conditions. Ginger's effects on blood circulation and pressure might be problematic for individuals with heart conditions. Its potential to increase heart rate and interact with blood-thinning medications could lead to complications. People with pre-existing heart conditions should exercise caution and discuss ginger use with their healthcare provider. 5. Medication interactions. Ginger can interact with certain medications, including blood thinners, high blood pressure drugs, and diabetes medications. Its natural properties might alter how these medications work, potentially causing unexpected results or health issues. Those on such medications should consult their healthcare provider to avoid adverse interactions. 6. Being underweight. While ginger aids digestion and reduces nausea, it can also speed up metabolism and suppress appetite, which might be problematic for those trying to gain or maintain weight. People struggling with being underweight should seek dietary advice from a healthcare professional to ensure they can manage their weight effectively. 7. Pregnancy. High doses of ginger during pregnancy, especially in the first trimester, could increase the risk of miscarriage. Additionally, its blood-thinning effects might complicate childbirth. Pregnant women should moderate their ginger intake and consult their healthcare provider to ensure both their health and the well-being of their developing child. 8. Low blood pressure. Ginger can act as a vasodilator, potentially causing a drop in blood pressure. For individuals with low blood pressure, this could intensify symptoms and lead to adverse effects. If you have low blood pressure, be cautious with ginger and discuss it with your healthcare provider. 9. Surgery. Before surgery, it's crucial to consider how foods and supplements, including ginger, might affect your body's response to anesthesia and other medications. Ginger may increase the risk of excessive bleeding and interfere with blood sugar levels, which could complicate the surgical process. It's advisable to avoid ginger for at least 1 week prior to surgery and consult with your healthcare provider. In summary, while ginger is a versatile spice with numerous benefits, it's important to be aware of when it might be best to avoid it. If any of these concerns apply to you, seek advice from a medical professional before adding ginger to your diet. This will help you enjoy the benefits of ginger while ensuring your safety. If you found this video helpful, please hit the like button and subscribe to our channel for more informative content. Thanks for watching.